Namaste. May Dr Srisanat Rao, Consultant Joint Replacement Surgeon at Zynova Shalby Hospitals. This Women's Day, let us talk a little about yourself, you women who make up such a beautiful part of the society. So you women go through many phases, from menarche to menopause, including a little bit of a phase called pregnancy. Now when you go through so many phases of life, it's not just the physical changes that affect you, but there is so much of an emotional turmoil that you go through. Now when you go through such a big turmoil, how do you tackle all the problems that you face? The first step in tackling all the problems that you face is awareness. And what should you be aware about? You should be aware that first, in women, there is a higher chance of arthritis. In women, after menopause especially, we have seen people tend to gain more weight and also a higher chance of fracture. Women also tend to ignore their health in the midst of taking care of everyone in their family. This Women's Day, let's make sure that it's just not that the family matters, your health is also given priority. So how will you give the priority to all these? First, you should make sure that you're having a very healthy diet. Second, make sure that at a younger age, you start exercises. If you are beyond a stage where you feel you will not be able to exercise, make sure at least the women in your family are doing exercises. That is inculcated at a very early age, like swimming, running, jogging, cycling. This is very good to prevent early arthritis and also to keep bones strong so that in the future, after menopause, there is less chances of fracture. What happens after menopause? After menopause, the estrogen in your body goes down. So once the estrogen goes down, the calcium absorption decreases. And once the calcium absorption decreases, your bones tend to become very osteoporotic. So how do you diagnose this osteoporosis? It is very important that after 50 years, you do something called a bone density scan or a DEXA scan. That gives us what is the severity of osteoporosis. If you have osteoporosis, just taking calcium medicine is never enough. Now there are many situations in life where people say after 50 you should just take calcium. Unfortunately, the bitter truth is that alone does not work. If you have osteoporosis, you need to take certain injections that will help in treating osteoporosis along with taking calcium and vitamin D3. There is so much of treatment involved in osteoporosis. You giving priority to it is very important. We at Zynova Shalby Hospitals do not just tackle one single problem. We are a team that involves myself, Dr Srisanat Rao, along with our gynecologist, our nutritionist, our dietitian, along with our physiotherapist, and we make sure that we tackle women's problem in a wholesome manner. I hope that you all make sure to give priority to yourselves. Thank you.